I think how we're going to do this is a very unconventional way of doing it, because no one's mic'd up. I will ask the question, and someone on the panel will put their hand up and say who wants to answer the question. We'll do a Q&A, and then I'll close the day. Is that okay? And then we'll get ready for supper.
Ask the delegates to put their hands up.
Fine. We've got too many questions here first. Oh. Yeah. Okay, so the first question is to Dr. Anton Baader. Can you please show and comment on the slideshow, the 12 signs, I'm sorry if I can't read your writing, the 12, I think it's signs of spiritual awakening.
And you have 10 seconds.
Okay, moving swiftly on. We haven't got time to have a whole discussion about this. Okay, the next question.
Sort them out, Susan.
I did, yeah. Is there an immune system?
I just say, I make it quick. Yes, there is. It's just the mental health definition is maybe slightly different. That, you know, body, mind, social, all that somewhat determines our immune system, how strong we are.
Also das Immunsystem,
immune system?
Natürlich existiert das, aber es ist nicht allein die Zellen, die wir messen können. Wir wissen auch, dass die Psyche und das Empfinden unser Immunsystem stärkt. Und wenn wir uns
has a powerful influence on the immune system.
Und wenn wir uns schlecht fühlen, dann ist auch die Reaktion des Immunsystems vermindert.
And so, as we know in mental health, if we feel bad, if we have conflict, stresses, that affects the immune system, obviously.
Und wir müssen immer berücksichtigen, wenn wir Immunsystem sprechen, es gibt so viele Faktoren, Hormone.
And so if we talk about the immune system, we need to know there's so many factors, right? Like hormones,
die verschiedenen Antwortzellen wie T1, TH1,
the
TH2.
different cells, T1, T2 and so on.
Wir haben den Magen-Darm-Trakt mit seinem Abwehrsystem.
The digestive tract with their immune system.
Aber insgesamt betrachtet hängt alles davon ab, wie die Information läuft. Welche Information gebe ich an meine Organteile?
But what really matters, how do I give the information, right? Biological information, how is that processed towards the organs, to our whole system?
Und damit sind wir wieder bei dem Thema des ganzen Kongresses über Glaubenssätze.
And that's where we're back at the kind of mental health perspective, also our beliefs and how we, I guess I add something to it, how we deal with conflictive situation and stress triggers.
Okay.
In the language
and by the way, Dr. Kwesi doesn't have a phone. Because somebody wanted a phone number. As a joke.
In the language of color, green is defensive, so that would be the color for the immune reaction, green, because it's defense.
Well, whilst we're on the subject of colour, the next question is, what is the significance of the colour purple?
There's a wonderful film with Whoopi Goldberg, The Color Purple. And we just had a female Christian Catholic priest or bishop here, vicar, and the male Catholic bishops, they wear the color purple because they want to be connected to God. This color is to be in absolutely resonance with your environment. The color of transformation, the color of inspiration, the color also of sexuality.
And still keeping with Dr. Kwesi, the other question is for you. Please, can you talk about the significance of the black and white as colours?
In the Lucia test, I didn't show the Lucia test. It's very beautiful. We also have got a chart where we've got white, gray, and black. And there it's about your mood, your actual mood. And what we've realized is that before color perception is being developed, in the first 3-4 months, when you have got a significant trauma, then this choice of the gray chart, how we call it, is very significant. Then you show that something happened and you want to separate. So between black and white, it has to do with trauma in the very, very early stage. And we've got not only the 4 basic colors, but we've also got 4 additional colors. And